Jean Paul Monsalve, and this is my presentation exploring the rise of precocious puberty in middle childhood. So this is my table of contents. I will be discussing what precocious puberty is, how it has risen in recent years since 2020, what our potential causes and factors have been, what we have led to believe to be potential causes and factors, signs and symptoms of precocious puberty, an overview of what it is and how it interacts with children in the middle childhood stages, and some solutions and treatments that we have for this condition. So, what is precocious puberty? Precocious puberty is a condition in which a child develops sexual characteristics earlier than usual. Usually, children experience puberty in girls ages 8 to 12 and in boys ages 9 to 13. However, when it comes to precocious puberty, there's a development of sexual characteristics in children earlier than that, which is usually seen in the development of breasts or early menstruation in girls before the usual age 8. Usually we've seen it in ages 5 to 7, and the development of pubic hair and a growth in the boys' testicles, usually before age 9. As we know, puberty usually occurs in the adolescent stage, around the teenage ages, so there has been a notice, like, when it happens earlier, people tend to notice because it's not what we're used to. So, the rise of early puberty was seen, well, it's been seen for some time. It's been a thing that's been happening throughout the ages, but so prior to COVID-19, there were already rates of precocious puberty that had been increasing, but after the pandemic, there was an exponential growth of all the cases of precocious puberty. Specifically in China, we see a lot of this because obviously China got hit first and they got hit the most by COVID. So the cases of the young girls and boys over there were up by like 30% in 2020. Now, some potential causes and factors that we have to this condition are varying. No one really knows 100% why, but we have a lot of theories and speculations as to what has led to it. So some doctors and some people believe that it is a direct cause of the infection, the COVID-19 disease. However, there is not much proof backing that up. There has also been a shown decrease in activity and an increase in body mass due to quarantine and people having to stay at home. And this has been followed up for reasons to why precocious puberty has increased. Like, the hormones in the body don't really go anywhere and they just keep building up. So obviously they start to show themselves through early onset puberty. A change in sleep patterns can also cause this because it messes up your circadian rhythm and your brain waves, and that will also cause your hormones to imbalance and change how your body develops and grows. There's also been speculation that an increase in technology usage has been a factor because technology is so new and we don't really know how it 100% affects our bodies. So children being more exposed to technology, specifically like iPad kids or like having to go to school online, can be a cause for these early developments in children. And naturally, stress levels have increased due to online school and the pandemic and having to stay at home and, all these worries that have been caused by these events, which again also heavily increases hormone production, which leads to early puberty. Another cause people have thought of being an increase, why people think it's increased, is because they think that due to COVID, having people stay more at home and monitoring their children more, that there has been more cases that people have been able to detect these changes more frequently due to them constantly being around their kids and seeing the results. You know. So, what are some signs and symptoms of precocious puberty? Some, well, obviously there are developments in both sexes that we can look for all around, such as acne, body odor, moodiness, changes in behavior, and an increased aggression, which are naturally signs of puberty, but we're seeing these in younger children. Specific developments that you can look out for in girls would be obviously the development of breasts, development of underarm hair, increased growth spurts, because girls usually go through growth spurts before boys do. So if they do get hit by those earlier, you'll be able to notice. Obviously, we have menstruation too, and then changes in their body, as in like their waists will slim down more as their hips expand, if that makes sense, because their body are developing. And boys obviously go through similar but different things, where they start to develop facial hair, their voice deepens and changes, their testicles enlarge, they get spontaneous erections, and the sperm production rate increases before they hit that puberty age. So overall, what do we see as regular growth in the middle childhood ages that we don't see in precocious puberty? Would be like, you know, typically in the middle childhood ages, children do tend to grow and they do tend to be active, but they only tend to grow about 2 inches a year, and their weight increases around 5 to 7 pounds like annually in normal circumstances. But with these early puberty cases, there's been a spike in this. There have been growth spurts, weight changes, a bunch of things that we haven't really seen as drastically as we have now. And the kids that are most to be affected by precocious puberty that you need to be looking out for, one thing to look out for is gender. Girls have been shown to experience this early puberty much more than boys have throughout history, and especially nowadays. And African American girls have specifically seen more cases than white, Hispanic, or Asian girls when it comes to early puberty. Obesity also is a large factor to check out for. So the 3 things to look out for when checking for precocious puberty would be gender, race, and weight. Also lifestyle. But now, where have cases of precocious puberty been seen to have increased within these recent years, past 2020? After the COVID lockdown in Brazil specifically, there's been a 50% increase of this precocious puberty. And in Italy, we have seen more cases of the girls experiencing this in the last 5 years than there have ever been throughout all of history. India also observed an increase in both puberty cases reported and children diagnosed throughout lockdown. So as we can see, it's mostly been like how do I explain this? Around the equator, where typically we do see more ethnic children, if that makes sense. Like, I'm saying this because I'm lying, my bad. But like, they, due to their conditions and their environment, there is more hormone production, whether it be the weather, it's hotter there, the sun hits more, the food that they consume is technically richer, so it can change how their like body reacts to it. And if you want to know how to be sure if your child is experiencing precocious puberty, there are many ways to test it. You can test their blood, their urine, x-rays of their hands and wrists to see if there has been any bone growth that is not typically seen in children, an MRI or a CT, which is a bit pricier but can also check their brain and the pituitary gland to see if hormone secretion has increased. You can test the thyroid, and you can also get ultrasounds to see how their bodies have been developing. Now, what can you do to help your child? While you obviously can't stop your child from experiencing puberty, there are ways you can help them go through this or understand what they are going through. Obviously, if you increase their activity and their exercise and, you know, make sure they're not sitting at home all day and on their phones, that will obviously help their hormone production regulate more. Healthier diets and pastimes also, again, not too much time on technology and eating healthier, better foods, less processed GMO foods will also decrease the puberty increase. Puberty blockers are also an option to use if you were tested and seen to be needed them, but that really should be more of a last result. And overall, if your child is experiencing development and growth that they're not used to, counseling can really just help them talk it through and understand how their body is changing, so they don't get stressed out or stressed out and have to deal with more. So in conclusion, while there has been a noticeable change in children going through puberty, it's not something that has exactly snuck up on us, because throughout history, people used to go into puberty up at ages 17, 16 regularly, and the age has just been getting lower as time passed on. It's just been increasing rapidly in recent years, and we have taken a notice of that. The pandemic was obviously an event that is not really something we are to expect and plan for. So the results of that pandemic has changed a lot of ways the world has developed, especially in childhood development, because there are things we have no other pandemic to reference. So honestly, there are many things you can do to help your children, but just being there for them and taking the precautions that you see fit are the best thing you can do to help your kid and your family. That was my presentation. Thank you so much.